Hi, my name is Schneider Dufart from Southern Adventist University, and this assessment is going to be for nursing health assessment class. This is my own work, and I will be completing this assessment without the help of a textbook or prompts. So we have here a 17-year-old client. He is alert. He has good speech. He is oriented. He is practicing proper hygiene, and he is well nourished. So the first thing we are going to assess is the head. We see here that the head is symmetrical with the shoulders. It is aligned well with the neck. The head shape is oval. The skin on the head is clean, dry, and intact. Okay, so I'm just going to touch your head, okay, and you tell me if it feels funny or tender, okay?
Okay.
So the patient's head is firm, it is symmetrical, the scalp is clean, dry, and intact, the hair on the scalp is curly and black, the eyebrows are straight and black and they are symmetrical, the eyelashes are also black and curly and symmetrical. Okay, I'm just going to ask you to do a few funny things for me. Is that okay?
That's okay.
Can you smile? Can you poof out your cheeks? Good job. Can you stick out your tongue? Can you move your jaw from side to side? Great. Now, next thing I'm going to do is check inside your mouth, okay?
Okay.
Good. Can you open your mouth and say ah? Great job. So the inside of the mouth is pink. It is moist. The tongue is firm. It is symmetrical. And I'm just going to touch your tongue. Yes, the tongue is firm. And will you smile? Teeth are aligned and white. The gums are pink. Okay, and will you stick your tongue out one more time, please? Just ah. Okay, I'm just looking at the back of your throat, checking for gag reflex. Okay. The next thing that I'm going to do is assess your ears, okay? So I'm looking at the size of his ears. The size of his ears are proportional to the head. They are symmetrical. Does this feel funny or tender?
No.
No tenderness reported in the ear. No tenderness reported in the mastoid bone. No nodules or edema. I'm going to look inside of your ear, okay? Okay, so I'm looking into your ear to look at your earwax. It is brown. Okay, it is also brown on this side, and there is no edema, which is very normal, okay? Next thing I will do is look into the patient's nostrils. Okay, will you tilt your head up, please? Thank you. Okay. And it seems to be pink, clean, and there is also some clear mucus present. It is aligned. Now I'm just going to push around on your face and you let me know if it feels tender, okay?
Okay.
How does this feel?
Feels fine.
Okay. Now can you move your jaw from side to side for me? And up and down? Great. All right. I'm now going to assess your eyes. Please take off your glasses for me. Great. Now cover one of your eyes and tell me what you can read.
95.
Cover the other eye. Tell me what you can read.
95.
Okay, uncover and tell me the lowest that you can read.
875.
Now I'm going to look at your eyes, okay? I'm going to be looking for some muscle movement within your eyes, and I'm also going to be looking for something called a red test, okay? Okay. I'm also looking at the color of your eyes, the sclera, the iris, okay? And it's all normal. Now, what I want you to do is to follow this with your eyes without moving your head, okay?
Okay.
Great job. Now I'm going to bring this around your eye. You let me know when you can see it.
I can see it.
Great.
I can see it.
Great. Next thing I'm going to do is I'm going to touch your eyes. I can see that there is no edema present on the face. And again, you're just going to let me know if this feels tender, painful, or weird to you, okay? You're doing great so far. Okay, close your eyes. That feel tender?
No.
Okay, no drainage is present. I'm just going to touch right here for your lymph nodes. Does that feel tender?
No.
Lymph nodes are able to move freely without causing tenderness. No edema is present. Okay. I'm going to touch something called your trach, okay? Let me know if that feels tender. Trach is aligned with the neck. No edema is present. No tenderness is present. Will you please stand? Thank you. I'm now assessing the patient's thyroid. No tenderness is present. Thyroid is aligned and symmetrical. Thyroid is aligned with the neck. Okay. Go ahead. Okay, next thing I'm going to be feeling for is arteries and veins in your neck, okay?
Okay.
Carotid artery is strong. Pulse is 75. Okay, just gonna assess interior and anterior of the vein. Okay, I'm gonna listen for any odd sounds, okay? Okay. Will you take a big deep breath? Good job. Big deep breath. 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 Okay, so the breathing is clear in all 8 lobes. When the patient breathes, the chest is symmetrical and even, and the patient's muscle tone is strong and even throughout the chest, the back, and the shoulders. Okay, shoulders are firm and symmetrical, even in height. Will you push your shoulders up against me? Can you stop me from pushing it down? Great. Okay, so the next thing I'm going to do is I'm going to feel for some lymph nodes that are within your arm, okay? Is that all right?
That's okay.
Okay, great. So you're going to feel me touch you. Okay. So the lymph nodes have mobility, no tenderness, and no edema. Okay, next I'm going to feel for some pulses within your arm. Okay, may I feel? Thank you. Okay, strong pulses. Again, patient's heart rate, 75. Okay, next thing I'm going to do is listen for some heart sounds, okay? Okay. Okay, great. All right, and we're going to check for some sensation and reflexes in the arm. I'm just going to tap you with this, and it's not going to hurt, okay?
Okay.
See that? Won't hurt. All right. Perfect. Again. Perfect. Okay, so the patient does have 10 fingers. There's no edema noted in the arms. Arms have short black hair. It is warm to touch. Skin tuber is elastic. Capillary refill less than 3 in the fingers. No edema in the hands. Okay, open your fingers. Can you keep me from pushing the fingers together? Good. Can you grip my fingers? Like this. Yes, good. Okay, raise your hands up. Now just your arms. Keep me from bringing them down. Keep me from bringing them up. Keep me from opening it. Keep me from closing it. Great job. Okay. Now I'm going to touch you with some objects. I'm going to touch you a first time, then a second time. Let me know if the object's different or the same, okay? Close your eyes. Same or different?
Different.
Okay, I'm going to put an object in your hand and you tell me if you can figure what it is, okay?
A cotton ball.
Cotton ball, great. Okay, keep your eyes closed. I'm going to move your finger up and down, and when I say when, tell me if your finger is up or down.
Okay.
Go.
Up.
Go.
Down.
All right.
Up. Up. Down.
Great. Great, you can open your eyes. Okay, so the next thing that I'm going to assess is your stomach, okay? Would you please lay down? So I'm going to listen for your stomach sounds, and then I'm going to palpate for your liver, your spleen, your gallbladder, and then I'll reach over and get your kidneys, okay?
Okay.
And I'll also be touching for an artery in your stomach, okay?
Okay.
So first I'm going to listen. Patient has hyperactive bowel movement. I'm going to touch. Let me know if it is tender. Okay. Will you cough? Will you take a big deep breath in? Push it out. Good job. Okay. Great. Now feeling for that artery. Just going to listen for any abnormal sounds in that artery. Okay, none noted. Will you please sit up for me? And I'm going to now check your kidneys, okay? If you feel any pain, you let me know. I'm tapping on the patient's back. I'm looking for a painful response, okay? It should not be painful, but let me know if it is. Great. Okay. So the next thing I'm going to do is I'm going to check for some lymph nodes in this area and a femoral pulse, okay?
Yeah.
Okay. Feeling the femoral pulse, strong. Does that feel tender?
No.
Lymph nodes are mobile. They are not tender or painful. No edema is present. The skin on the legs are clean, dry, and intact. They are warm. Okay. The hair present is short, curly, and black, and evenly distributed throughout the legs. Okay, we are going to check for some reflexes in the legs. All right, this will not hurt. Good job. Okay. Okay. Great. Can I just slide this under your foot? Good job. Great. Okay, and I'm going to check for some pulses. Will you put your feet up like this? This? Great. Even, equal, strong pulses. Again, strong, equal pulses. Okay. Can you lift your feet straight up? Okay. Can you keep me from pushing them down? Can you keep me from bringing them up? Stop me from bringing it up? Keep me from opening? Keep me from closing? Great job. Bring them down. Okay. Next, I'm going to have you stand up. I'm going to be assessing the patient's thorax. It is even, symmetrical. Again, muscle is spread out evenly. Okay. Anterior thorax, PMI, at a ratio of 1 to 2. Angle 90 degrees. Check the back. Will you face this way? Okay. Okay. The clavicle is even, aligned. The muscle is firm, equal in height, symmetrical. Will you bend over and touch your legs, please? Your feet, actually. Let me know if this hurts. I'm going to feel on your back, on your spine. Spine is aligned. No tenderness reported. Spine is straight. Okay, thank you. Going to touch on your hips. Hips are aligned. No tenderness reported. Okay, turn around. Now, can I have you walk from the bed to the wall on your tippy toes, please? Great. And can I have you walk back on the side of your feet? Just walk forward on the side of your feet. Great job. Now turn around and walk back on the heel of your feet. Okay, great. And you can turn right back around. All right, next thing I'm going to have you do is stand like this, together. Okay, I'm going to have you stand still. Great. close your eyes. Can you stand still? Perfect. Now I'm going to have you walk to the wall with, like this, heel in front of your toe, just like this, okay? Thank you. Great job. Okay. Thank you. Okay, you may be seated. All right. Thank you so much for being my patient today. And thank you for watching.